our weekly COVID-19 press briefing by our county executive, Marc Elrich, Dr. Travis Gales, our health officer, and also Dr. Earl Stutter, who is the director of the Office of Emergency Management and Homeland Security. I'm Lorna Virgili, Hispanic Public Information Officer from Montgomery County, and I will be the moderator today. With that being said, for members of the media, do remember to use the chat box for permission to record and also for you to ask questions. I do identify yourselves because I don't know all of you. And with that being said, I'm going to toss it over to our county executive, Mr. Marc Elrich. County executive.
Yeah, thank you very much. And thank you all for being here today. I think I have a relatively undramatic briefing. So I'll start with some of the stuff we've done in terms of changes. Last Friday, we announced that we're allowing venues such as indoor and outdoor restaurants to include live music performances as part of their dining experience. However, establishments are prohibited from allowing dancing or congregating in front of the performers, and individuals present must still wear masks unless they're eating or drinking. And things went fine over this weekend, then there were no reported incidents of violations. We've continued to expand our testing locations, and today our online registration for testing is now available. And unfortunately, we've noticed a reduction in the volume of testing around the state, and we're encouraging people to please get tested. It's important to test in order to avoid the spread of the virus. We know that asymptomatic people carry and spread, and it's important for people to get tested whether or not you've had contact with somebody who has COVID, because you don't actually know if you've had contact with somebody who has COVID. So we're encouraging people to come back to the testing. Our stuff is reopening. We did, have a slight decline in the county during the period of adjusting to the new tests, but we are back into the swing of this, and we really do want people to come out and get tested. The county launched phase 2 of its $20 million funding for the rent relief program. We are beginning to provide additional assistance to eligible residents. The $20 million comes from the Corona Aid Relief and Economic Security, or CARES Act, and it expands rental assistance and homelessness prevention to low-income households that have experienced loss of income due to COVID. We are encouraged. The state has announced an additional $16 million coming out statewide, and we're hoping that we at least get a few $1 million of that. And I'm also hoping that since the state's economic forecast was better than they had anticipated, that they're able to provide some additional funds as they recalibrate the state of their budget based on the latest data they have. You can get more information on testing and our program requirements, and not testing, but we can on testing too. On testing, but also our housing requirements. You can get that information from the county's COVID-19 website. We have ramped up our Mask Up campaign. We're partnering with Montgomery County Economic Development Corporation, Visit Montgomery, and the local business community today to launch a multi-platform outreach campaign that we're calling Mask Up Montgomery. We need people to wear masks. I'm fully aware of the fatigue that people feel, and we continue to battle with both that level of fatigue, people's perception that if you're opening stuff up, it must be okay, and the governor moving to additional phases, which most people interpret it as, well, the problem must be over or almost over or not really so bad. We have too many cases. Too many people are testing positive. Our load is too high. It's true here, and we're not even the highest place in the state. There are counties in the state that even exceed the governor's guidelines for when you should be open. So it remains a problem, and everybody, at least the medical folks, are saying they expect this to return in the fall with greater vengeance. And what we're trying to do is drive our baseline down so there's less of a platform for the virus to jump off of. And we're going to continue to do that. The partnership with the business community has been great. I think everybody there realizes that the way we keep our stores open is to keep the virus in control. And so the help and the work they do to help us with that is really important. And, we're asking residents, please don't make a store owner or an employee come up to you and tell you to put your mask on. That puts them in a difficult situation. If you really don't want to wear a mask, don't go into that person's business, but don't put them in a position to have to confront you over that. Just have the grace to decide you're not going to go there if you aren't comfortable with having to wear a mask. Today's cases, we had 53 positive cases in the county. This is a pleasant break from last week when I think we peaked at 140 cases. As I've said before, this just shows you that you don't know what lies around the corner. And, there was a point when we were down at 45 cases and lower. And a week ago, we're looking at 140 cases. Today, it's 53. You can't assume anything from one day or a couple of days that whatever you see now is going to be a prognosis for the future. It's not predictive. It just tells you this is the people who came in and got tested. So we're going to always continue to monitor that. When the governor was talking about reopening, he talked about Connecticut, New Jersey, and New York as examples that Maryland could follow. And I just want to give people a little comparison point on this. In terms of new cases per 100,000 over 7 days, Connecticut has 18 per 100,000. New Jersey has 23 per 100,000. New York has 21 per 100,000. Maryland has 68 per 100,000. That is not the same number as these other jurisdictions. I just noticed that New York will open restaurants, which are already open, even in Montgomery County, indoor dining. They're going to announce they're going to allow that on October 1st, but they're only allowing it at 25% capacity. And they will reevaluate on November 1st as to whether they can go to 50% capacity. All of these other jurisdictions eased their restrictions when their rates were lower than Maryland's rates, and they've been still more cautious about what they've opened despite having better rates than we do. So we're, if we're looking at them, we're looking to see what happens there and if they can sustain these numbers. But we continue to think the numbers here are too high. The governor made an announcement today about the Interstate Compact with the Rockefeller Foundation that will expand the use of point-of-care antigen tests. These are really important tests, but he didn't have an update. We don't know when these are going to be available. We don't know whether they will be available, if there will be disbursement to the counties, or whether the state's going to handle all of that. We do know that he emphasized that it'll be used in places like nursing homes, correctional facilities, colleges, and universities. So stay tuned. And if we get more information, we will share that with you. And I understand that Maryland will be the first state in the compact to get testing. And in the meantime, the county continues to look into the same kind of tests and see what we can do to secure those tests from Montgomery County when they become available. And with that, I'll turn it over to Dr. Gales.
Good afternoon and happy Thursday. I caught myself since we're used to doing this on Wednesdays, but happy Thursday to you all and hope you and your families are continuing to stay safe. I'd just like to add a couple of points to the remarks made by the county executive. When looking at the overall numbers over the last week, we did have some days that gave us pause, where we did see a number of days, case reports over 100. In fact, there was one day of 140. And so we continue to look at that to gain and glean knowledge to see where there are cases. The challenge is that there is just widespread community transmission, and it makes it a little bit more challenging to isolate and identify spaces that may be causing upticks and outbreaks. Now, that said, we do continue to, when we have identified those places, we conduct our contact investigations to find out more information. And at this point, we have a number of of ongoing investigations that do involve churches, some schools, a correctional facility with the case, as well as we recently had a number of cases associated with one of our homeless shelters. So we continue to follow the trends and follow the numbers to guide where we're going. And as the county executive mentioned, across the state, in fact, we over the last week, we've seen increases in test positivity rates, as well as cases per 100,000 for the state overall, as well as many of the respective jurisdictions. Now, the other point that he mentioned is that we have seen this in the setting of decreased testing, and we are continuing. We've talked about this for a number of weeks now, where we have seen multiple days where we've seen low test reporting volume. And while we continue to ramp up our volume, which I'll talk about in a second, for example, yesterday there were only slightly over 9,000 tests resulted for the entire state of Maryland. So we're continuing to work with our colleagues across the state and our colleagues at MDH to figure out ways to break through testing fatigue and ensure that we have removed as many obstacles and barriers to testing as we can. As you know, the county apparatus is back up and running. As the county executive mentioned, our online scheduling system is back up. And so folks can register for their appointments as they did before. And in fact, yesterday on our testing day with a couple of different sites, we tested just shy of 800 individuals. And today we have a couple of sites live, including the Silver Spring Civic Center, where folks can get tested. So we're hopeful our numbers will continue to rise. We are also hopeful that the percentage and the number of tests done by the healthcare enterprise will continue to increase as well, particularly for those individuals who aren't demonstrating symptoms. Now, one number I do want to highlight, and if I get my tech skills right, this will be okay, is when we break down the testing numbers where we've talked about, one of the points that I have highlighted over the last several weeks is that we are seeing a higher percentage of new cases in the younger age groups, particularly those under the age of 30. And we have been highlighting and talking about those within the 0 to 19-year-old age group because, as we've seen, college campuses are reopening and experiencing cases, as well as our schools are reopening. And so it's important to keep track of that number. So I just want to share a graphic with you that underscores and demonstrates how we have moved in terms of the percentage of cases. So when you look at the graph here shows the 7-day average of the percentage of new confirmed cases in the age group of 0 to 19 years old. And so as you can see over time, in the beginning, this was heavily a disease that was impacting older populations. But as time has moved forward, you have seen an increasing trend. And as of yesterday, the 0 to 19-year-old age group for the state is approximately 25% of confirmed new cases, and the percentages here in Montgomery County mirror the averages of the state system. So this is a significant concern because we're seeing higher numbers. We do know part of this is because younger people are getting tested more frequently now with increased access, but we're also just simply seeing greater cases. And so we're continuing to work with our colleagues in the contact tracing arena to discover strategies of what may be causing this and make sure that we have appropriate messaging to this age cohort to diminish potential transmission. And that underscores the last thing I want to mention is that we have to remain vigilant. This is continuing to be a long haul and we have a long way to go, but we've got to have people continuing to wear their face coverings, limit their exposure to individuals from outside of their households, minimize physical contact, and continue to do follow other public health guidance to minimize transmission. And the last thing is get your flu shots. Happy to answer any questions you all may have.
Thank you, Dr. Gales. And for members of the media, do remember to use the chat so that we can move on to the portion of the questions and answers right after Dr. Earl Stoddard. Some remarks, please.
Good afternoon. I only have a few comments so we can get to the questions. I know we're running a little bit later. First off, with elections, we continue to work on our election preparations. Our election task force will meet again this afternoon after this call for about 3 hours to discuss all kinds of things related to how we ensure that both our mail-in and in-person elections go as smoothly and safely for all involved as possible. Over the last week, we've been able to ramp up through inclusion of our Department of Recreation staff into the Board of Elections ballot application processing. Last week, we were averaging about 5,000 ballot applications a day. We had 10,000 ballot applications processed yesterday, so we've ramped up considerably. We know the state is coming online with their system to allow for those to be processed as well. So we're getting through them as quickly as we possibly can. We continue to work with our faith community as well to look at how we can modify our accommodations for houses of worship. We had a meeting yesterday with a multi-faith group of leaders to talk about exactly how we can modify our existing rules to be a more reasonable for a broader array of the faith community, as well as how we can look at possible expansion of certain capacities in that arena. We're going to have some additional follow-up conversations, but I believe that yesterday's conversation was it went well and it was well received, and we're very receptive to what they have with their concerns, and we're going to move forward with some additional planning with them to see if we can make some changes in that arena. On Friday is our next meeting with our non-public schools. Friday afternoon, we're going to do another webinar essentially with Dr. Gales and I to talk through with some additional considerations from the state guidance, as well as provide feedback on, anything that they have questions on. We're going to answer those questions and try and address as many things as we possibly can. This is going to be part of an ongoing series that we have with the non-public schools as we committed to back in July. And then the last but not least, enforcement update. So we continue to do enforcement, obviously, particularly as it relates to complaints that we receive. We also do some prospective work on the weekends, particularly as it relates to our late night restaurants and bar scene, because we've seen that be an area of some challenge. Last weekend, I think it was Saturday night, we visited 21 businesses. We did issue one citation, but it was actually for a non-COVID related permitting issue. So it had nothing to do with the COVID regulations. And there were 4 warnings issued where we continue to see some, excessive people at a table, people walking, people dancing, things of that nature. And so we continue to send out messaging to say, obviously if, as county executive alluded to, our businesses know that in order for us to be able to operate, we have to be able to do so safely, and we continue to work with the businesses in that arena. We are also, obviously are looking at if there are other things that we can do to support the business community as well throughout this process to ease the burden that they are feeling, and we will continue to do that throughout the event. So with that, I will stop.
Thank you. We have the first question coming from Amy Cho from NBC4. Amy, would you like to pose the question, or do you want me to read it from the chat?
Sure, I can say it. Are there any current outbreak investigations involving non-public schools?
Yes. We actually to date have had, I believe, approximately 13 different schools that have had incidences involving cases of teachers and staff and students. We currently have, I think, 7 ongoing investigations that involve non-public schools that have cases. And in some of those instances, and at least I believe 2 of them, we've had to quarantine a group of students who may have been exposed.
Okay. We have a question here from Colby Satterfield from Channel 9. Can you talk about the rent relief neighborhood requirements for phase 2 of the rent relief program? County executive, maybe?
Which requirements?
Her mic, it's not working, I hear. But that is the question that it's been written here on the chat. Yeah.
Let me
Overall, talk about the rent relief program.
So the rent relief program, the money has to be tied to people who are unable to pay rent because of income loss due to COVID. And we are using the CARES Money Act to help fund this. We are targeting neighborhoods that have high concentration. They're starting with targeting neighborhoods with high concentrations of poverty, I guess is the geographical issue. So there are some neighborhoods where there are especially high numbers of affordable units. There were studies done. I know that the HHS benefited from a study that looked at relationship between homelessness and concentrations of poverty and inability to pay rent. And so they're looking at places that might be most vulnerable to generating more homeless folks. And so it's going to start there, and then we'll be making it available to more people. And hopefully the state money will be something that we can add to the mix. If they allow us to use the same guidelines as the feds, we'd be able to add that to the mix of people that we're helping.
Thank you, County
So
Executive.
I can add a little bit to that based on the guidelines. So eligible renters are those who are 60 or under 60% of AMI, which is average median income. It's approximately $65,500 in Montgomery County for a family of 3. And that lost income has to be due to COVID-19. They have to be rent burdened or behind on rent, and they have to be a resident of Montgomery County since at least February. And so households can have, we're not really looking for that they, there are some that have informal lease agreements. We're still allowing those to be considered for this particular program as well. And so what we'll do is for those who are approved, they can receive up to $4,000 in rent arrears and a rent credit for future months. It'll be paid directly to the landlord when a formal release agreement exists. And then eligible households who have an informal rental agreement will receive a rental assistance based on their monthly rent cost up to $4,000. So that's a little bit more on the actual requirements.
Thank you, Dr. Stoddard. We have another question from Candy Cintron from El Sol Radio. Candy, would you like to ask a question, or do you want me to read it from the chat?
I could ask Governor Hogan, and thank you so much for Lorna for the invitation. Governor Hogan today announced rapid testing. When is Montgomery County going to have this type of testing available, and when do you foresee this happening?
We don't have any further guidelines beyond the brief announcement that the governor mentioned. So unfortunately, at this time, we don't have any further details to be able to answer your question more specifically. Our hope is that we would be able to benefit from the testing, but at this point, we don't have any of the specifics in terms of how it will be disseminated and which groups it will be sent to.
Thank you, Dr. Gales. Amy Choff from NBC4 has a follow-up question. Again, on the non-public schools question for Dr. Gales. Amy?
Yes, hi again. So I have a few follow-up questions, so I'll say them quickly. What is the protocol for when someone tests positive at a non-public school? Is there a standardized protocol, or is it up to the school? Also, are you able to confirm any of the names of the schools at which there have been outbreak investigations? And then finally, given that there have been 13 outbreak investigations, is it possible that in the future, the county may order all non-public schools to close?
Well, the first, your second question, actually, I'll answer first is, due to privacy concerns and particularly the ongoing nature of some of the investigations, I'm not able to disclose the names of the schools at this time. And to the first point in terms of the protocol, so the protocol of notification is the same as it would be for non-public versus public schools. So there's nothing specifically crafted out for that. For the non-public schools. So what happens is if you are an entity and you find out, you are notified that you do have a positive case, you are required by the COMAR and state regulations to notify the local health department that you do have a positive case and to comply with the needs of the contact investigation process that is led by the local health department in concert with the state health department. So that is the expectation. If a school, non-public or public, do find out about a case, it's their responsibility and requirement to report that as soon as possible to the local health department. Now, once that is done, there are a number of steps that happen. And as in any situation where there's a positive test, there is a thorough contact investigation that happens where their questions are asked in terms of who the case has been around, how long have they been around them, to assess and get a sense of what other individuals may have come into contact with that case and are deemed to be high risk exposures, because then that process determines who needs to be quarantined and also, provide them with further guidance to mitigate any potential transmission to others who they may come into contact with. Now, one of the great things is we have with increased testing access now is we have the ability for folks to get tested, after they have been identified as an exposed individual to a known positive case. And again, we do work in the instances where we have had the known outbreak cases and investigating in school settings as well as others. The schools have been compliant with providing us the necessary information to be able to complete the investigation process. Now, to your third point, in terms of an overall statement, based upon the governor's and the secretary's orders, we are, treating each of the schools individually. And as we would do in any instance where there is a business that is involved with the case, we would complete the investigation process to determine the full scope of actions needed to be taken, such as closing a classroom, cleaning a building, or closing an entire school for the time needed for full quarantine and isolation time period. All of those types of steps are determined by what is found during the contact investigation process.
Thank you, Dr. Gales. We actually have here a question from a county resident, Vona Heaton. And is there a planned information for distribution of a vaccine when one is available? Number one, and a follow-up to that, how will you determine a vaccine is ready for distribution? Will you rely on the CDC, FDA, or other guidance?
Well, in terms of the dissemination of a vaccine, that is a process that we have been working on for some time now. So we actually, as part of the public health enterprise, we have a team that oversees we have an immunization program. And part of their task is, even in the absence of COVID, they operate and organize vaccine distribution throughout the county, including the flu vaccine. And so that team has been working on an aggressive, proactive dissemination platform for the flu vaccine. And similarly, behind the scenes have also been working, and we will continue to work with partners and other agencies across county government, as well as our healthcare partners, to devise a strategy for effective vaccine dissemination once it's made available. Now, in terms of assessing the efficacy and safety of it, we do rely on the FDA, who oversees those processes in terms of approval for vaccines. We do rely on them because they are the ones conducting the large-scale studies that assess the safety, potential side effects, and the efficacy of any vaccine or medical treatment that is released.
Okay, so I see we don't have any more questions from members of the media here on the chat. Going once, going twice. Any member of the media that would like to pose a question or do a follow-up? No more question, guys. So I guess this is a wrap up for the day. It's a short briefing. It's a short briefing for today. Thank you, everybody, for joining us. And of course, we will be returning next week with our usual weekly media briefings. Thank you, everybody. Have a great afternoon.
Thank you all.